SDG2, the Big Questions. Where did it begin?
Have you noticed how poor health and poverty are often linked?
Absolutely, it's a vicious cycle where one can cause the other.
Right. At the local level, things like lack of money and cultural barriers can really prevent access to health services.
And at a larger scale, poverty can lead to widespread health issues like infectious diseases. It's a real problem.
I read that overcrowded living conditions can spread airborne diseases like tuberculosis.
Yes, and using traditional stoves can cause deadly indoor air pollution too.
Environmental factors play a huge role in health. Pollution can lead to a lack of food and clean water.
Exactly. Social determinants like income and education really shape health conditions for many people.
It's shocking to think how many factors like gender, race, and where someone is born can affect their health.
It really is. The systems in place can either help or hinder people's health outcomes.
So, understanding these connections is crucial for addressing health disparities.
Definitely. It shows how important it is to look at the bigger picture when discussing health issues. Why does this issue matter?
Have you thought about why ensuring health and well-being for all is so crucial?
Absolutely. It's about supporting those who face unequal access to health services and treatment.
Right. And social, cultural, and environmental factors really impact health literacy and access to care.
Exactly. For instance, a safe and healthy birth is vital for mothers and children to reduce risks during delivery.
That's a significant point. Many mothers and infants need trained support to minimize complications.
And let's not forget about early childhood. Children under 5 are especially vulnerable to disease and malnutrition.
Yes, access to vaccinations and good nutrition can really protect them from early death.
Preventable diseases are another concern. Quick and quality treatment can help manage epidemics effectively.
True. It's all about reducing the spread of contagious diseases through proper care.
And we must also address addiction. Treatment and education are key to preventing substance abuse.
Improving access to information about sexual and reproductive health is also essential for overall health.
Absolutely. Informed choices about one's body are crucial for exercising health rights.
And ensuring access to health services and vaccinations is vital for the well-being of the population.
Yes. Safe and local access to these services can make a huge difference in community health. Who and what are affected? Poverty and poor health services really put children in danger.
Exactly. The neonatal mortality rate dropped from 31 to 19 deaths per 1,000 live births between 2000 and 2015, but there's still a long way to go.
And women face unique barriers too. Many sacrifice their education and health for their families.
Right. Access to health services, especially reproductive health, is crucial for women. It's a global issue.
Speaking of global issues, did you know that in 2012, around 889,000 people died from diseases caused by poor sanitation?
That's shocking! Clean water and sanitation are so vital for survival.
Absolutely. And air pollution contributed to about 6.5 million deaths that same year.
It's a hidden crisis, too. Mental health issues affect so many people globally, with suicide being a leading cause of death for young people.
Yes, in 2012, an estimated 800,000 people died by suicide, and most were under 70.
And substance abuse complicates things further. Only about 1 in 6 people with drug use disorders got treatment in 2013.
It's frustrating how these issues often go unnoticed, making them harder to address. What is being done?
Did you know that over 33% of the world's population practices open defecation?
Yeah, and that's a huge problem because poor sanitation leads to diseases like diarrhea and dengue.
Exactly. Improving access to clean water and promoting hygiene practices can really make a difference.
And we need to build proper latrines too. Fixing old ones is essential to prevent contamination in communities.
What about healthcare workers? Stigma can be a major barrier for vulnerable populations seeking treatment.
Right? Negative attitudes towards conditions like HIV/AIDS can prevent people from getting the help they need.
Increasing the number of trained healthcare professionals is crucial for working with these stigmatized communities.
Absolutely. And we can't forget about mental health, especially for refugees and asylum seekers who face significant challenges.
Post-traumatic stress and culture shock can really impact their ability to settle in new communities.
Speaking of vulnerable groups, women also face issues with access to sanitary products. In India, only 16% of women use sanitary pads.
That's shocking. Organizations like Sathi are doing great work by using local resources to create sanitary pads.
Yeah, and raising awareness about female hygiene can help break down the stigma and improve access.
Climate change also plays a role in health issues, affecting clean air and safe drinking water.
Definitely, and poor health practices can contribute to environmental degradation, creating a vicious cycle.
It's important to share information about the impacts of climate change on health to reduce vulnerability.
And initiatives like the World Health Organization's collaboration with choreographers to raise awareness are innovative ways to address these issues.